Norwood type A's variation. And then when we talk about women, women can have three principal types of hair loss. One is the classic Ludwig pattern. As you look at the website, you'll see that those drawings. In a Ludwig 1, you're getting hair loss which is diffuse with or without preservation of the frontal hairline, and then that becomes more moderate, and you can really see through the hair area in a Ludwig 2. By the time you hit a Ludwig 3, there is significant diffuse loss where it's almost basically bald across the central scalp, and that is something that you really would necessitate looking at a metabolic workup and finding out if there's something else as a causative factor for this significant degree of hair loss in a female. And the key hallmark of the Ludwig is it's a central centrifugal loss that occurs over the mid-scalp area here that may or may not have preservation of the hairline. The other one is you could have a Norwood or Hamilton type of loss in terms of like a male pattern baldness. That can also occur in women. So women can also exhibit a degree of male pattern baldness. And interestingly enough, they can also preserve more or less the frontal hairline. The thought behind that is that the aromatase levels that are in there can preserve the hairline. And sometimes in men, if there's a higher aromatase or whatever may be the cause, they can also preserve a hairline and have diffuse thinning behind that frontal hairline. And then the final type of hair loss is noted by Olson in 1994, where there's what's called a Christmas tree pattern. Essentially what this is, if the person bends her head downward, you'll see a Christmas tree pattern on parting the hair out this way. Olson believes that the majority of hair losses actually fall into this Christmas tree type of pattern, where you're seeing this, either with or without preservation of the hairline again, this pattern where the frontal area, as the hair is parted, is more lost and then less and less loss as you go backwards. And there's just a ragged border as you go, particularly going posteriorly backwards. You can also have what's called lacunae, which Unger found in 1987, which are little spots of hair loss in a female. And those are basically the three types of classifications of female pattern baldness, but of course you can have other variations as well, just like in male pattern baldness. They may not fit the classic Norwood or Hamilton scheme. Hopefully that was a nice short video on just having to understand where you may fall in your type of Norwood loss as you come to see us in consultation.